I'm Jeni Beecham. I'm Professor of Health and Social Care Economics at the PSSRU. I work at both the University of Kent and the LSE branch. I've been at PSSRU for ever such a long time, since 1986, so quite a long while. I currently work on mostly issues to do with services for children and young people. But when I first started at PSSRU, I worked on mental health economics. So back in the time when mental health economics was very, very new. And so I still do some work in evaluation of services for people with mental health problems and bits and bobs in services for children with learning difficulties as well, and adults with learning disabilities. Oh, it's quite a long time. It's about 30 years. It's not changed very much in some ways, and in other ways it's changed massively. Overall, the size, the number of people working at PSSRU has increased phenomenally. But I think more interestingly is that the research areas we cover are much wider, much larger range, wider range of topics, a much greater number of topics as well, and lots of different methodologies. Very big increase in the number of economic evaluations we do. Lots of work around developing schedules, lots of work around secondary analysis. So I think the scope of the work has changed enormously. And of course we had the move from just being based at the University of Kent and now got that very strong presence in at LSE again now. It would absolutely focus on the transition years and young adulthood. I think one of the real failings of social care is to help young people move from children's services into adult services in their adult lives. And what happens so often is that children are relatively well served in terms of getting the support they need in children's services, and then they arrive at adult services and they don't meet the criteria for care, or there's not enough services to meet their specific needs. And the families are the ones that are really challenged by that, because they have to provide more support for the children, and the children are becoming young people and they want to become independent. They want to do things for themselves, they want to live their own lives. So that's a real challenge, and not least because people end up sort of circling around the further education system, and there's no work opportunities, there's no way of supporting them into work opportunities, there's no way of supporting them into leisure activities, or supporting them to find their own peer groups. So that's where I really think social care policies should be focused at. I'd need a lot of funds. It would be a longitudinal study of children leaving care services, because I don't think, again, it kind of hits on that transition area again, hits on that area where children are becoming young adults. But we really don't know enough about what sort of care services work well, what sort of care services help children who are looked after, what services help them, prepare them for young adulthood, and then where these kids end up after they've left care. You hear lots and lots of horror stories about high proportions of homeless children having been in care, but you don't actually know what's happened to children as they leave care, as they've been through the leaving care system, if they're lucky, and what's happened to them afterwards. But it would have to be very longitudinal. I want to follow them up for 10, 15, 20, 30 years. It's a lot of money. I think despite the increasing proportion of older people and the increasing needs for support of older people, I'm going to stick with young adults again. And I'm going to stick with this transition area because I think that unless you support young adults, then the likelihood of them succeeding as adults just gets smaller and smaller and smaller and smaller. And they're the next generation. They're the people who will be paying taxes to pay for social care in the future. They're the future employees. They're the future employers. So it's really, really important to support young adults. And I think that is going to be crucial. If you can't support young adults, and if the families have to stop supporting them, then they're going to need high-level services in the future. So I think it's a big issue in the next 10 years.